call this special meeting to order. Can I get a motion, please, to adopt the agenda? Moved by Councillor Andrews, seconded by Councillor Roper. All those in favor? Carried. Petitions and delegations. Councillor Gerwing?
Yeah, I would like to make a motion to move to have the presentation and discussion of the report in camera in accordance with section 91K of the community charter.
Very well. All those in favor? Carried. Very well. Moving on the agenda, new business item, Peace River Regional District call to action, Ministry of Health audit for Northern Health Authority. Councillor Gerwig.
Yeah, so as reported, and it's in our council information package, and as reported in the Alaska Highway News article by Tom Summer, the Peace River Regional Hospital District at their November 18th meeting has renewed their call for a provincial audit of Northern Health. For those who have not had a chance to read the article, I'll just share a few quotes. I promise I won't read the whole thing. So Mayor Ackerman is quoted as saying, "We need to have an audit done on Northern Health that looks at the good, the bad, and the ugly." Mayor Ackerman moved an amendment calling for the audit, which all the directors approved. She continued to explain she's looking to examine just how much is being invested in healthcare in Northern BC, whether or not they're investing adequately and appropriately in the healthcare for our residents. So she brought to question whether the province is actually contributing enough towards healthcare in the north. Mayor Fraser suggested that, these are quotes, "We were afraid when it happened that we would lose our ability to have any amount of real input with respect to healthcare locally. I think that this audit may just show that this experiment," he was talking about the health authorities, "is not working anymore." He goes on to suggest going back to local health boards, giving regions more autonomy and local decision-making capabilities. And Mayor Bumstead called the MOU a historical document that has become antiquated and wants more done to ensure staff is in place to run equipment that's being purchased. Further discussion about how we are funded and supporting the funding of health services on behalf of our residents and our region was discussed by Mayor Bumstead. And so then, I really think that this article is reflective of what I'm hearing from NRM residents, past council's thoughts, and many members of the NCLGA Healthcare Committee. As I would never presume to speak for this council, I bring this call for an audit to your attention and would like for the NRM council to be on the record calling for a provincial audit of Northern Health, including a focus on how much money is being invested in healthcare in the north and if the amount is adequate to meet the needs of the residents. So I have a motion if.
Sure. Councillor Gerwing, Resource Municipalities Coalition had the same motion requesting an audit of Northern Health, which I signed and I agreed to. You haven't seen that yet because the minutes of that meeting have not been approved yet. So, but it is coming. And I also spoke with Corey Ramsey, the president of North Central Local Government Association today regarding that very issue, that I think the North Central Local Government Association should get behind this call for an audit of Northern Health. I think an audit of Northern Health can only be good in, it may just simply highlight that the provincial government is not doing enough funding for Northern Health. It may highlight that there are gaps in their procedures in communities that they serve. So I think this audit can be nothing but good, and I would wholeheartedly support that audit. And I would also ask that council make a recommendation that we put this on the agenda of North Central Local Government Association as an emerging issue, so that North Central Local Government Association can look at this and bring it forward to its members. So we'll ask for some discussion, and then Councillor Gerwing, it'll be back to you for a motion. Any other thoughts on this? Very well, Councillor Gerwing, I'll ask you to make that motion.
Okay, just before I make the motion, I'm just wondering, what kind of advocacy efforts do you see happening? Like, would we just submit a letter in support of the Peace River Regional District Hospital Board call? Or do we have some of our own advocacy efforts that we would want to do? And then other actions that anybody might have in mind? Like, first and foremost, I would like us to support the letter, but is there other advocacy efforts that we wish to put forward?
I think we can support that letter, and I think we can write a letter on our own to Minister Dix. And I think we could add into that motion that we ask North Central Local Government Association to look at this as well.
I think they are.
Yeah, Ms. Ramsey asked that we make a motion formally requesting North Central Local Government Association to
Okay.
add this to the, so I thought we could just
So-
add that into the motion.
So then if I made a motion that we support the Peace River Regional Hospital District's call for an audit of Northern Health in a manner that council determines, that being a letter of support, our own letter, and a call to the North Central Local Government Association to address this as an emerging issue.
I would second that motion. Are there any comments on the motion? Very well, I'll call the question. All those in favor? That motion passes unanimously. There is no further business. I'll ask for motion to adjourn the special regional council meeting. Moved by Councillor Gerwing, second by Councillor Penny. All those in favor? Carried.